So I would like to demonstrate the wobble chair today. Now I'm sitting on a wobble chair. There's a wobble chair right next to me. And the purpose of the wobble chair is to put the spine in motion. So it creates a pumping effect on the discs. It stretches the soft tissue such as the ligaments, the tendons, the muscles. It also brings oxygen and blood into the area. And one other thing, important thing that it does is it creates a pumping effect on cerebral spinal fluid. So in other words, a fluid that surrounds your brain and spinal cord, and it creates that pumping effect for nourishment and detoxification of your nervous system. So the way the wobble chair works is sitting on the wobble chair, the upper leg should be about parallel with the floor. And the wobble chair, demonstrating on this one here, moves in all different directions at about 40 to 45 degrees. So patients, when they come into the clinic, they sit on the wobble chair to warm up their spine for the adjustment. And there's two major motions that we do here. Number one motion is bringing the hips forward and bringing your torso back at the same time, creating motion throughout your spine from your lower back to your mid back to your neck area. The second motion is going side to side. So now I'm going to be concentrating on bringing my shoulder down to my hip and my ear down to my shoulder. So in other words, it looks like this. I'm bringing the shoulder down to the hip and I'm bringing the ear down to my shoulder. And we do this in both the directions, back and forth. Very important when we're doing this is to keep the torso upright, not in a hunched position, but in an upright position to create the proper biomechanics in the spine. And back and forth, just like this. So that is the demonstration of the wobble chair.